So pulmonary fibrosis is a type of interstitial lung disease, and basically pulmonary meaning lungs and fibrosis meaning scarring. So pulmonary fibrosis is a progressive scarring disease of the lungs. Patients with pulmonary fibrosis can present in a very nonspecific manner. They can present with shortness of breath, with usually dry cough, sometimes fatigue, tiredness, and oftentimes they'll present to their primary care physicians or even to their cardiologists. And people may think, well, this is a heart condition, or they'll write it off as being old age, deconditioning, being overweight, and they won't seek the attention of a pulmonologist or have a pulmonary evaluation until further on into the disease than they realize. So for idiopathic pulmonary fibrosis in particular, we use history and physical exam detailed, looking at past exposures, other comorbid conditions that they may have that can interact with the lungs. And we rely heavily on imaging, so high-resolution CT scanning gives a lot of detail about the lung tissue and the pattern of lung injury, and we can sometimes diagnose IPF on the basis of the combination of those things with the high-resolution CT scan. So for IPF, there is no cure, and in the United States, there's no FDA-approved therapies. For those patients, I encourage them to look into research, clinical trial options, and we have some of those available here at our practice. Other things that we sometimes do to help with the disease is management of symptoms like cough and shortness of breath. We prescribe supplemental oxygen when that's appropriate to try and help them maximize what they're able to do. Physical therapy through a pulmonary rehabilitation program is very important and can actually really help to improve the quality of life and level of shortness of breath that people experience. I also encourage involvement in support groups with lots of education and reaching out to other people that have similar conditions. When I'm talking to patients, we have to understand the limitations of our current medical therapies, and that's important. But then the other thing I always focus on is what can we do to help a person? Education is very empowering. Reaching out to groups like support groups for pulmonary fibrosis and meeting other people, learning more about their disease and disease management. Symptom management is always important, and being involved in knowing what's out there in terms of new therapies that are on the horizon and potentially contributing to that knowledge by participating in research therapies as well.